Would you like to feel a little more confident on the home remedies front for your child and your family? That is today's show with one of my favourite paediatricians. You'll know that if you listen to the podcast live, every month we have amazing low-tox businesses helping you with your swaps or stock-ups. Check out the two offers we have below, both for Aussies, with the Edible Beauty offer also being for our US watchers and listeners. Enjoy. Hey, Elisa, how are you?
I'm doing great, Alex. I'm so excited to be here today.
Oh, I'm excited to have you. And Low Tox Kids was a vision to kind of dive deeper into the one day that we have for kids in the Go Low Tox main course.
Yes.
But of course, there's like 80% of parents do the course and they're like, I want to know everything I need to know for
That's
children.
right.
And so we decided to branch off and go a little bit deeper there. And I think something that really a lot of people feel confused about, disempowered by, whatever you want to name it. We're not sure that we're okay to go ahead and treat our kids with a few of the more, if you like, easier to treat things at home.
That's right.
And there's so much conflicting advice. We see so many doctors say, don't try any of that home remedy stuff. A, it doesn't
right.
work. Or B, it could be dangerous, and we're scared into kind of not doing anything at all. And yet there is the whole other side, which is exactly why I'm so excited to have a physician-approved chat with you today, which is actually, yes, there's a lot that we can do, that we can reduce our pharmaceutical usage in our kids today. And I'd quite like to start by just asking you a really general question around kids. And there's so much that they face today that they did not face 100 years ago, right?
That's right.
As a physician, what are your biggest concerns about the environment that we're seeing our kids grow up in the modern world today?
Yeah. There's it's not even just 100 years ago. Think back just even, 30 years ago, 40 years ago when I was a child, when you were a kid, the mamas and the papas growing up now, childhood is very, very different than what we had as kids. The explosion of cell phones and, Wi-Fi and these electromagnetic frequencies, I think is a big, reason why many of our kids are sick. I do think that EMFs play a role. Look at the food quality, packaged foods, TV dinners. I totally remember when some of the packaged foods, Rice-A-Roni, Hamburger Helper, Kool-Aid, all of these things that were really hot and new, when I was a kid, and were touted to be like the next best thing, right? Make your life easy with these super healthy foods that you could just, pop into the oven or throw in the microwave. Microwaves were new, right? I remember just staring at, this food going around in a circle, pressed against the window, right? like watching your food heating up magically, right? So we look at, this advent and this explosion of packaged processed foods with all of these food additives, and then we look at microwaving and also even as we move now towards realizing that packaged processed foods are not the healthiest for us, the nutrient density in our foods, even organic produce, has gone way down. So there's so many factors. I think the food we're eating, the air we're breathing, look at the amount of car pollution and just all the pollutants in our air, and the pesticides, glyphosate, Roundup. Worldwide. That's another huge contributor to the different, toxic burdens that our kids are facing. And I think another huge toxic burden that our kids are facing that has always been there, but has just, kind of exponentially increased for us and as parents and for our kids, is emotional stress. We cannot forget the toxic burden of psychological stress. Psychological stress creates just as much inflammation in our bodies as physiologic stress. And, we are all way busier and, scheduled and stressed out than in any time in history. And when I talk to my friends or the parents who come into my office and ask them how they're doing, there's not a single parent that tells me that they have enough time, right? That they feel calm, that they feel like they're not too busy, or that their kids aren't too busy and their kids are not getting too much homework and too little sleep. I mean, this is our lifestyle has completely changed, and that's something that when we talk about toxicity, we need to understand how do we reduce that? How do we change our lifestyle? Because we can, eat as organically as we'd like to, take away all the chemicals, as much as possible from our kids. But if we're not sleeping enough and reducing our stress burden, we're not going to get as far as we'd like to in optimizing our kids' health.
So, so true. And you mentioned so many things there. And it's so common for our parents' generation, the baby boomers, to say to
Mhm.
us, oh, come on, we used to take you to McDonald's every Saturday and you
I know.
didn't die. But if you
That's
look
right.
at what the fries were fried in, they were fried in grass-fed animal beef tallow until
Yeah.
1984. So as a little kid, that's what I was eating, and that there's nothing really very wrong with that. In fact, it's actually a
That's
brilliant
right.
fat.
That's
So,
right.
and
Well,
now
and for
it's,
and for most of us, we as children, going out to a restaurant or going out to McDonald's or,
mm,
going to get an ice cream, that was a treat. That
mm,
wasn't a daily occurrence. And when we look at what's in most of our kids' lunch boxes and what we eat for dinner, I mean, most of our kids eat out of a package daily,
mm,
right? There's very few of our kids who have completely unprocessed whole foods in their diets and eating out and eating fast food, even the, healthier fast food like Chipotle. I mean, that's, a several times a week to almost a daily occurrence for most of our families.
that's it's so for you, the concern is especially the fact that there's a big frequency attached to
Yeah.
these habits. Yeah.
Yeah, yeah. Because our bodies, I mean, I tell parents, unless your children are very sick, if I have a child who comes to me and they already have an autoimmune illness or they have autism or they have, some sort of, an inflammatory process going on, while we're trying to heal, we do need to be very careful about what's going into their bodies and how we're supporting them. But, I tell parents, our bodies are meant to clean up and detoxify and really keep our bodies healthy, right? We
Mm,
have to trust in our innate sort of healing processes and our body's desire to be healthy. I mean, if we give our body a chance, our body is going to move in the direction of health. It's just when the burden gets too much and the balance tips
mm,
to having too much toxicity in our lives that our body can't keep up with what it's trying to do.
mm.
So if we're healthy already at a baseline, then yes, we can handle McDonald's or our kids can handle the Skittles at the birthday party. We don't have to,
We
kind
don't
of
have to freak
freak
out. Yeah.
out at every little thing, right? So it's about balance, and we want the balance to be healthy,
Yeah.
right?
I always say you do what you do most of the time, so you don't have to worry about what you do some of the time.
That's absolutely right. Yeah,
Yeah.
absolutely. We don't want to live in fear
Mm,
and paranoia, but that's if we can really find that good balance.
brilliant. And in terms of some of the effects, you mentioned autoimmune issues. I mean, I don't remember anyone in our generation really at school experiencing
Yeah.
multiple autoimmune diseases or allergies. What else are you seeing the most of in clinic?
Gosh, I mean, I guess my clinic is a bit self-selected because I have kids who are coming to me because their parents are seeking more natural care,
Mm,
integrative care, and also parents who have kids who have been diagnosed with an illness and conventional medicine either isn't cutting it or the kids are having too many side effects or parents are really hoping for a more natural approach. But of course, this explosion of eczema and asthma, with increasing severity, um, you know, some kids are literally being born with eczema. Their parents tell
mm,
me they come out itchy and scaly,
mm,
right? The number of digestive issues, infants with reflux. I mean, in training, I just couldn't have imagined the number of kids, babies, at a week of age, 2 weeks of age, who are being diagnosed with, gastroesophageal reflux disease and being put on proton pump inhibitors and antacid medications like ranitidine, Zantac here in the States. And, that has implications from birth of shifting the gut microbiome, depleting B vitamins and impairing methylation. All of these things that we hear about are so important for detoxification, the gut microbiome and methylation and optimizing our genetic potential. But, we're starting from infancy a lot of times with disruption there already because of the medications we're giving to our kids.
Right.
And kids who have the explosion of autism, right? Where in, some states the numbers are as low as 1 in 33 children, with autism. And other neurodevelopmental issues, ADHD. I can't tell you the explosion of the number of kids with mood disorders, anxiety, depression, even bipolar disease, oppositional defiance disorder. So, and these are things that, they are the new normal now, right? We expect to see kids with rashes on their skin, and, we expect kids to have sensory processing issues. When I was in training, and this was not too long ago, I mean, I did my residency training at UCSF, which is a highly prestigious academic center here in the States, and we, saw the sickest of the sick kids, but, I had never heard of sensory processing disorder. That wasn't a diagnosis. And this was back in the late 90s, right? Fast forward now, 20 plus years, and it seems like every kid has sensory issues. And I don't think it's just a matter of us diagnosing more kids. I think, there are more and more kids. I mean, most kids nowadays don't feel comfortable in their skin, right? I mean, the tags bother them. They're anxious because of all the sounds around them, and so these are unfortunately things that are more and more commonplace. And I think, most pediatricians are not equipped to understand how to get to that sort of root cause approach of healing them from the inside out and helping them, thrive moving forward.
Yeah. And with all of these illnesses come, as you alluded to before, with PPIs, a lot more medication. So let's just talk about that, because the aim of the game is to reduce this in today's chat. Let's talk about painkillers. It seems like it is routine to use painkillers with our children today. We see the ad about a more comfortable life for our baby, or teething, like we just hit the Panadol or ibuprofen, whatever you want to call it, Tylenol. Like, it just seems to be a go-to. But what is the implication of using painkillers too often? Now, I'm not talking about what we do some of the time, because sometimes acutely these can be really helpful, but it's definitely not the case that this is a sometimes thing. In so many situations, I see it being handed out like candy, and I'm really worried. So talk to us about the effects of painkillers with our kids if we're using them too often, and what too often actually means, like what it looks like.
Gosh, I mean, that's so, that's hard to say. I mean, for kids, of course, we don't want to see our children uncomfortable, miserable, in pain, and, and there is a time and a place for everything. But I think, we want to allow our body to use its natural healing systems. And so, for instance, with some surgeries, they found that ibuprofen can prolong the healing, and some surgeons recommend not using ibuprofen as that painkiller, right? Because we're inhibiting that in the normal inflammation process that's occurring, that's driving those white blood cells to the site of irritation, inflammation, infection, and we're preventing that from happening. So then we're preventing the healing from happening in an appropriate way. When we think about ibuprofen and acetaminophen, there are a couple of different concerns. Ibuprofen, of course, we know one of the side effects of any NSAID class of medicine is gastric irritation, right? Gastritis, inflammation of the intestinal lining and the stomach lining, and gastric ulcers and bleeding can be seen with prolonged use. And that can happen, very quickly, where we start to see stomach aches, pain, ulcerations, and either microscopic or even, obvious bleeding with dark red blood, in this dark stools, right, indicating that there's some bleeding going on higher above. What my concern is, even with short-term use, is when we see any inflammation and irritation in the gut lining, that is going to lead to disruptions in the gut microbiome, right? We're changing the natural pH in our gut lining. We're changing which bacteria want to grow and thrive there, what other opportunistic organisms like yeast or, or parasites may want to take hold. And the gut is the foundation of our health. I mean, the gut is the heart of our nervous system, our immune system, our endocrine system, and our hormonal axis. So if we disrupt the gut regulation that's going on, that's going to have lots of long-term consequences for our children's developing immune systems, developing brains, and developing, hormonal systems. So that's, with ibuprofen. Of course, long-term use can affect the kidneys. Acetaminophen, I have different concerns. Acetaminophen can affect the liver.
So this is like a paracetamol type thing.
Paracetamol, Panadol, right? Tylenol.
Yeah.
So with acetaminophen will directly lower our levels of a very important naturally occurring antioxidant called glutathione. And glutathione protects the liver. It enhances detoxification. So when we take acetaminophen, we are directly impeding our body's ability to detoxify from whatever it's trying to detoxify from, whether it's internal toxins or external toxins that are coming in. What we found with painkillers like acetaminophen and ibuprofen, which are of course also used for fevers, right? They're fever reducers as well. When kids are sick with certain viral illnesses, using a fever reducer to artificially bring down the fever actually prolongs the duration of illness. It keeps our kids sicker for longer periods, and it impacts our kids' ability to fight infections. And in fact, can prolong, for instance, if you have the flu and you take acetaminophen, to help reduce the fever, you're going to shed, right, virus from your nose for longer periods. You're actually also going to be contagious for longer periods.
Wow.
I'm not going to sit here and tell you that I've never used ibuprofen or acetaminophen for my kids. I actually, when kids have fevers, I would recommend using ibuprofen because the impact on glutathione and our ability to fight infections is really significant, and with acetaminophen. So I prefer not to use acetaminophen. But even then, I reserve fever reducers for when our kids are so miserable and unhappy that either they can't fall asleep because sleep is so healing and restorative, or they're just not drinking, right? They're too uncomfortable to drink, and dehydration is probably the biggest risk of fevers. So this is where our natural remedies, we know there are many great ways to reduce fevers using herbal medicines or homeopathic medicines or even acupressure and acupuncture without suppressing the fever. So there's a difference, right? There's a difference between suppressing fever artificially with acetaminophen or ibuprofen and versus using our natural remedies to help our body manage the fever and address the fever and fight fevers to shorten the duration of illness without artificially suppressing.
Cool. So we'll go into, I think I want to ask you a couple more questions about a couple more medications first, and then we'll go into our natural remedies. Talk to me about allergy meds. This is another thing I've seen popping up, like baby versions of like Zyrtec and all those sorts
Claritin,
of
Zyrtec, Benadryl, right?
That didn't exist when we were little. So why is that popping up, and what are the effects of taking those too often or long term?
Well, we know, first of all, it just shows you how common allergies are now, right? Whether they're food allergies, even anaphylactics, scary food allergies, and environmental allergies. So many kids have allergies nowadays that didn't, it's so common to see kids now with itchy red eyes or sneezing, sniffling almost year round. And even, eczema, and asthma, there's a histamine component to all of these illnesses. And in fact, many of our chronic illnesses have a histamine component to them. The problem with taking antihistamines is they really don't do anything to address the histamine burden, what's going on, the root cause of why they're having histamine issues in the first place.
Mm.
Um,
And why do
so
you think that is?
I think a lot of it has to do with adrenal fatigue, even in our infants and children.
Wow.
I think it goes, a lot of it, we know that mothers who have adrenal fatigue are more likely to have kids with allergies. So, I think the best we can do for our kids is prioritizing mama's health, before conception and during pregnancy, and really kind of, thinking of that time as this precious time to grow this most precious little being, right? Which we don't do. I mean, we don't give moms the time and the space they need to really be as healthy as possible, during their pregnancies. But I think that is playing a big role, and I think this kind of adrenal fight or flight is really rampant even in infants. I think that's why we're seeing so many more infants with really bad colic and crying and screaming and uncomfortable. And then, with these antihistamines, again, they're going to mop up the excess histamine that's floating around, which can absolutely be a lifesaver for kids when they can't sleep because they're so stuffy, right? And their eyes are so itchy and miserable. But again, using our natural remedies like quercetin to stabilize that histamine release, and then cleaning up our diet and our toxic overload so we're not, releasing histamine all the time is a more healing way to go for the long run.
Okay.
And then reserving our antihistamine, same thing with, pain and fever reducers. I mean, reserving those for times when we really need it, right? When things are really, not manageable, but then trying as much as we can to heal, from the ground up so that we don't need them in the first place.
Yeah, so true, isn't it? There's nothing wrong with, no one needs to feel guilty about needing to turn to medication
Yeah,
in
yeah,
times of acute situations, as long as our long-term goal is to not need to turn to them quite
that's
as
right.
often.
That's
Yeah.
right. Yeah.
And something else I see is so many kids have a Ventolin puffer in their backpacks at school
Yeah.
for
Yeah.
asthma. So,
Yeah.
it seems to be totally safe. It seems every single kid's using them. Are there any long-term effects that we know about with Ventolin use?
Well, and I would say I would, also talk about Ventolin and steroid inhalers, right? We have the
Yeah.
albuterol, the rescue inhaler, and then so many kids are on prednisone or prednisolone or budesonide inhalers for their asthma and even allergies, inhaled steroids, nasal steroids for their environmental allergies. So with albuterol, albuterol will deplete minerals. Right, we do have to worry about, sodium, potassium balance, magnesium, and so long-term use is going to cause depletion of those minerals. Those minerals are so essential for our proper cellular functioning, neurotransmitter production, for just overall calm and well-being. Now, with Ventolin, albuterol, that is a rescue medicine, and so I would never tell a parent, if your child's wheezing, don't give it. But again, we need to figure out, why is this kid wheezing so much? What are they missing? That their lungs and their body needs, and their immune system needs, so that they don't need it as often. One of the things that we know that kids with asthma are that their lungs are deficient in compared to kids and adults who don't have asthma, is glutathione, right? Glutathione, I mentioned, with acetaminophen, that it gets depleted. Also magnesium, which is going to, the balance is going to be depleted also when we're taking various medications. So we may be, helping with the rescue immediate fix, but we may actually be causing more dependence in the long run, right? And then, of course, with the steroid inhalers, we used to think, well, if it's inhaled into the lungs, it's not going to have as much of the systemic overall body effect. Absolutely not the case. And in fact, a study just came out showing that, steroid use for asthma doesn't actually help long-term outcomes, right? I mean, the thought was, oh, it's going to prevent long-term lung damage, but we're not finding that. And we are finding effects on growth on bone density, even with inhaled steroid use. In fact, I had a child with eczema. And simply by putting topical steroids on their skin, this child went into adrenal crisis.
Wow.
And so, and that was just with topical. And so, we need to think everything that we put on our kids' skin, everything our kid breathes in, that gets absorbed directly into their bloodstream. And I mean, like it or not, there are going to be some systemic effects, and some kids are going to be more sensitive than other kids. So, we do need to think about, not just the medicines that our kids are swallowing and, ingesting, but, all the other routes where these medications can get into our kids' bodies.
And when it comes to medication, is it because it's a medication that transdermal application does then seep in past the dermis? Because sometimes like you put like zinc oxide for sunscreen, but that's not going in because the particle size is bigger. Or like folic acid in your shampoo, even if you might have an MTHFR mutation, but because it's the type that's in the shampoo, it's not going to go into your skin.
It really depends, because some things are going to get absorbed more easily. When we have medications that are meant to be transdermal, they're in, a carrier form that makes them more easily absorbable. But, many even non-medications, toxins are going to be absorbed through the skin. So we want to think, right? We want to think about our skin as our largest organ and one of our largest absorptive surfaces. So, that's why Epsom salt baths, even if you're taking a bath, you're going to enhance your magnesium levels and your sulfate glutathione levels because it's going to be absorbed through the skin. So, I mean, zinc is just a larger mineral, so that's not going to be able to penetrate, right? But other things are going to be able to be penetrable through the skin, whether or not they're medication.
Cool. Okay, well, not so cool, but
I know, right? I mean, Epsom salts are great, right? But
get in the bath.
That's right. But maybe not parabens, right?
Yeah, maybe we'll skip those. Yeah,
that's right.
So we've talked about some of these effects, and they all give us really good motivation for working with practitioners who help us change the long-term outcomes. I think that's the most important thing, because we're such a pill for ill society that we look so close in front of us. Often we're not playing the long game. So that's the most important thing. But the second thing that we really can do is reduce our medication by changing what we use. And something that comes up again and again, I think because it is so visually unsettling to see our child in pain from an ear infection, let's say. I want to start with ear infection, because that's one of the big ones that everyone goes, we definitely need antibiotics and we definitely need painkillers. But I've seen more and more come up with successful holistic treatments.
Oh, absolutely.
What are your go-tos for an ear infection?
Well, I'll say earaches are the most common reason for a visit to the pediatrician's office, whether or not there's an infection. And, the majority of ear infections will actually resolve on their own. So that's something that parents need to understand. Even if they're bacterial, they can resolve on their own, right? So most ear infections actually aren't going to require antibiotics to heal. Some will, but many, many won't, which is why actually the American Academy of Pediatrics, several years ago, changed their guidelines on prescribing antibiotics for ear infections. So for kids who are, over 2, and even kids who are over 6 months, but there are guidelines to really have this watchful waiting approch, right? Don't give antibiotics right away. Wait and watch for those, if your kid isn't very sick, right? And there are particular guidelines, but for most kids, you can take this watchful waiting approach and hold on the antibiotics and see, will your child get over their ear infection on their own. Now, in the meantime, there's no guidelines on what you do for this child. In the meantime, right, they're crying, they're in pain, maybe they have a fever, right? So what are most parents going to do if they don't have this kind of natural medicines toolkit under their belt? They're going to, use the Panadol, right, the acetaminophen. Which then may prolong the duration of their illness, right? Or maybe they'll use ibuprofen. Well, with our natural medicines toolkit, I mean, there's so many things we can do that actually are evidence-based. There is good science to show that many of these natural remedies are safe and effective. And the hard part is, as a mama going out there, or as a papa or a grandparent, you know, there are tons of resources online, but you don't know what to trust, right? You don't know.
Yeah,
I mean,
that's
there's some
it.
amazing natural recipes for garlic ear drops, but then you're thinking, well, is this, this is someone that writes about holistic health, but how do I know it's actually going to work? And how do I know it's safe? And how do I know how to use it? So that's where, I'll work with patients to really understand how to do that. But we know, for instance, there's one study looking at an herbal eardrop formula that contained garlic, some St. John's wort, some mullein flower, and they found that this particular herbal preparation, topically drops, was more effective at reducing pain and healing the infection than amoxicillin, right, which is the most common antibiotic, given for ear infections. And so there is this particular eardrop now is readily available commercially, at least here in the States. We use, gosh, I'm totally blanking on the company. It's Herb Farm. Herb Farm has garlic eardrops that has this particular combination. But there are many herbal manufacturers that use, organic, wild-crafted herbs, very reputable. And this is where, I do urge parents, do your research or find a holistic practitioner to work with, because you want to use reputable manufacturers who can guarantee that what's in their formula is what's on the label, right? And also guarantee that their manufacturing processes have strict quality assurance controls so that they're getting high quality products that don't have impurities, right? Because we know, I mean, some herbal formulas have been tested. For instance, some of the herbal remedies from China or India, Ayurvedic medicines, have been found to be contaminated with heavy metals, right? Some of the topicals have been found to actually have steroid creams. So no wonder they work so well for eczema, right? So you want to make sure that it's a reputable manufacturer. So that's where I try to take the guesswork out for parents. But yes, so this combination of garlic eardrops, you start in the ear, anti-inflammatory, analgesic, so it's going to help with the pain, and antimicrobial. So garlic is going to help whether it's bacterial or viral, right? I mean, at least half of your infections are going to be viral, and not bacterial. So even if you started the antibiotics, it's not going to do a thing, right? So that's my go-to. If you have an earache, ear infection, starting, and you're not sure, whether or not they need antibiotics, even before you go to the doctor's office, as long as there's no fluid draining from your ears and your child's eardrum hasn't burst, go ahead and start the garlic ear drops. It's going to be amazing, right?
And how can we know if it is more serious? Like you mentioned, eardrum burst. Like, how do we know that's happened?
Yeah. So if your child has a burst eardrum, typically there actually isn't much pain, because it's the pressure of the fluid behind the eardrum pushing out that causes pain. So oftentimes, once an eardrum is burst, you'll see your kid is not as uncomfortable, and you'll see some fluid draining from the ear.
Okay.
Like it might look like wax at first, but you clean it off, and then an hour or two later, you look at, oh, there's a little more wax. There's a little more. So it just, it keeps draining. Right. It doesn't happen often, but it can, right? So that's one sign where I just would want, and even then, it doesn't necessarily need oral antibiotics. You might just be able to use topical, ear drops, because oral antibiotics, I mean, one of the reasons, I mean, of course, antibiotics can save lives, but the disruption, we need to think about the disruption to the gut bacteria.
Absolutely.
Right? And we hear these stories all the time, right? Where kids, they'll get an ear infection, they take the antibiotics, they get a little better, and then 2 weeks later they get another ear infection, and they need the antibiotics again. And you get on this vicious cycle. You feel like you're on like a hamster wheel, right? There's never any antibiotic cycle. And it's because the gut, again, it informs the immune system. So if you don't have those healthy levels of good probiotics in your gut, your child is going to be more susceptible to another infection. Right?
And something that I've seen talked about quite a lot is like even just spraying a colloidal silver nasal spray right on into the ear. What are your thoughts on colloidal silver? Are you a fan?
Colloidal silver can work great for any infection. I mean, I use silver, hydrosolized silver, for gut infections.
Oh,
Um,
wow. Okay.
but you have to be careful with the silver, right? Because silver, I mean, it is a heavy metal, right? So we
Mm.
don't want it being absorbed into the bloodstream. So I use a hydrosol silver, right? Sovereign silver is one that's, hydrosol that's not going to be absorbed systemically. Designs for Health has a silver that's not going to be absorbed systemically. So I think there absolutely can be a time and a place for that. The nasal spray that I prefer is a xylitol nasal spray.
Okay.
There's one called X Clear. I don't know if you can get that in Australia, but it's a saline spray that has xylitol and a little bit of grapefruit seed extract. Xylitol. So we found that xylitol in chewing gum form can help prevent ear infections.
Oh,
So
wow.
my kids use a toothpaste that has xylitol because xylitol also helps fight the bacteria that cause cavities, right? So if your child is prone to ear infections, you can have them, brush with a xylitol toothpaste or chew xylitol gum. Use the xylitol. I recommend, using the xylitol nasal spray whenever you've gone on an outing, on a plane ride, a birthday party, anytime where, or your child has had a play date and their best friend who you had a play date with, you notice when you pick them up, their nose is really runny, right? So just preventatively, use a xylitol to flush out any of those germs in your child's nose that are trying to colonize and grow, and also help clear the ear passages and help prevent ear infections. So that's another, easy tip, for prevention and also for treatment.
Yeah, awesome. Now, essential oils are all the rage. And this is another one where we see there is quite a bit of scientific literature online around the use of essential oils, especially because countries like France and Germany have used them for centuries.
That's right.
And still do use them in hospital care. So it's an integrated part of their conventional medicine model. But in American Australia, it's like the vogue of every Instagram blogger seems to be able to tell you how to fix your child. And I just want to be mindful and safe here and hear your opinion on whether you would ever bring essential oils into the mix with something like an ear infection.
Absolutely.
Okay,
absolutely.
Cool.
So, I use, in terms of what natural remedies, modalities I use, I incorporate, herbal medicines, nutritional supplements, homeopathic medicines. I do teach parents how to do acupressure, and I use essential oils. And yes, essential oils are the rage now, right? I mean, it's like you can use an essential oil for everything. But, we do want to be mindful and cautious of safety concerns for kids. And there are all sorts of varying things that you read online, from, never use essential oils in infants to yes, they're safe. In general, I wait until kids are about 3 months of age to use essential oils. These are more theoretical concerns, but some of the stronger minty oils, especially eucalyptus, there have been case reports and studies showing that when eucalyptus is used directly under the nose in premature infants, that it can slow their breathing, slow their respiration. So, I wait until
like you mean neat, like using it undiluted. You mean?
Yes, undiluted.
Okay, so let me get this straight. So this is just such a great illustration of fear-mongering on the internet then, isn't it? Because the study was about a premature baby and the oil was used neat, undiluted.
Yes.
And then everybody freaks out about eucalyptus for children, full stop. So
now I have used, I used essential oils on my babies, right? When they were having, colicky, spit-uppy stuff, when they were 1 month of age, right? But, for essential oils, you always dilute for a child.
Yes,
always, right?
Exactly.
You never, I don't use essential oils neat for kids. I mean, I guess I have used lavender neat, right? Because that's such a mild essential oil. But, I always dilute them. For some of the essential oils like eucalyptus and thyme and
oregano, cinnamon.
They're going to be cinnamon. They're especially irritating to the skin, so you need to dilute them even more. Some of the essential oils are going to be photosensitizing, especially the citrus ones, right? What does that mean? That means if you put them on your child's skin and you go into the sun, it's going to discolor their skin. Not permanently, but if you come in and they have this weird rash on their skin, you know what it's from, right?
Yeah.
So in general, I start with the more gentle essential oils like lavender or chamomile. And lavender absolutely has been shown to have anti-inflammatory properties, analgesic, pain relieving properties, fever reducing properties. And of course, calming, anxiety reducing properties. Same thing with chamomile. Those would be the first two that I would try and start with, right? And you start low, you can dilute and even put on the feet and just see how your child responds. Every child is different. With anything, more isn't always more.
Yes.
Right. And, and now in our society, it's like you look at every single kid's, skincare product and, shampoos and massage oils. I mean, everything has lavender in it. So at a certain point, right, it stops having its therapeutic benefit because you're just inundated by it, right? So, using it judiciously, you don't have to have everything scented, in your home. And I find, I've actually stopped using the diffuser in my office. I used to, have oils diffusing all day long, but they stop working after a while, right?
Yeah,
so you just take
agreed.
a break, and I literally, will sometimes when I need to, I'll open up, peppermint essential oil, and if I'm in a lull in the afternoon, I just open up the cap and I don't even put it in the diffuser. I just have the essential oil, from the bottle, just
give it a good
naturally.
good sniff,
and that's it, right? Everything in moderation, right? We want to use things judiciously, right? I mean, we're in this day and age where, people think, oh, more is better, but it's definitely not. And, the way I like to use essential oils is actually using them on acupressure points to have more therapeutic benefit. And there are some acupressure points, for instance, with a child with an ear infection, which typically starts off with a cold and congestion, the point large intestine 4, which is right here on the back of your hand in this web space, right, between your thumb and your index finger, right? It's a great point for congestion. It's a great point for earaches. It's a great point for headaches. It's a great point for constipation, right? So this point, if you're massaging, right, with doing acupressure on your child, you can just have some essential, you can have some lavender, right here, and just have even more benefit, right? The other point that is really great for ear infections and fevers, they often go hand in hand, right, is large intestine 11, which is this point right here, right? You bend your elbow, and at the outer crease of your elbow, in the depression, that's large intestine 11, right? And large intestine 11 has been shown to actually have fever-reducing properties in studies, even large intestine 4. And so put some lavender essential oil there, or chamomile essential oil. You're going to have calming, you're going to have anti-inflammatory properties, and you're going to help with the congestion. So there are some ways. Yeah. So that gives even added benefit. I mean, there's some great essential acupressure points that we know from studies work and are effective.
Awesome.
Right. And then, homeopathic medicines. I mean, homeopathy, we're right now, in the States, there's been quite a bit of controversy on homeopathic medicines. And right now there is a look now at the FDA, from the FDA, on how to really maybe regulate homeopathic medicines in a different way. But, homeopathic medicines have been used in France and Germany and the UK, for really for centuries.
Absolutely.
And there are, and it is not, homeopathy is one of those modalities that people have the hardest time wrapping their minds around, because the idea is you take the substance that in pure form causes the symptoms, right, that you're trying to treat, yet when diluted to what are called infinitesimal dilutions, to the undetectable levels, it treats those symptoms. Right. And so the example I give for parents to kind of understand what that means is, we take the example of an onion, right? And when you slice open an onion, what happens? Your eyes water, you sneeze, your throat gets a little scratchy, right? The very same symptoms that you might experience at the start of a cold or at the start of an allergy attack, right? So then we take an onion, and we actually serially dilute it to, 10 to the minus 30, where there's no detectable onion left. And, we use that dilution to then treat those beginning symptoms of an allergy or a cold. So then you think, well, if it's so dilute, I mean, there's nothing there. This surely is placebo, right?
Yeah.
Or, or or it's just complete, complete hogwash, right? Well, we know, I mean, there are some fascinating studies looking at homeopathic histamine, right?
Mm-hmm.
Histamine causes, right, allergies, right? So these researchers in, I think it was 4 different labs across France, um, took histamine in these ultra dilutions, various dilutions, no histamine detectable, right? And then they took these white blood cells called basophils that have a lot of
Yeah.
histamine in them, right? And attached, basically allergens that cause them to release their histamine. So when these basophils were then bathed by these dilutions
Mm.
of histamine, at these ultra dilutions, undetectable, and then faced with the allergen, the basophils were stabilized so that no histamine was released. And this was reproduced in each of these labs.
Wow.
So, I mean, it's fascinating,
That
right? We
is.
know. Mhm. And homeopathic oscillococcinum, which, I mean, as you head into winter, in every health food store, every Whole Foods here in the States, you're going to see oscillococcinum, the homeopathic flu remedy, on every single shelf, right? And there are studies showing that oscillococcinum, when given at the start of a flu or flu-like illness, it doesn't even have to be influenza, a flu-like illness or a febrile illness, shorten the duration of illness by at least 48 hours and had patients experiencing either significant resolution of their symptoms or complete resolution of their symptoms at a much faster rate, significantly, faster than patients who got the placebo.
Mm.
Right. So again, I mean, oscillococcinum, especially when you take it in the very beginning, so, can be really effective.
Yeah.
And because they're so dilute, they're really safe, right? So I incorporate homeopathic medicines. It can be a game changer too, when we're thinking about how to treat kids. So I can tell my patients, with confidence and, from a medical perspective, I'm not concerned about toxicity or interactions with other medications that they might be on. And also that I know that they can be really effective too.
Yeah. And to the point of fever, because you've mentioned a couple of things already, the lavender with this point, I'm totally
Yeah,
going to
yep.
take that on board. And something else you mentioned for fever, I can't even remember what it was now, but um, to that point, so our kid gets a fever. You can speak in Fahrenheit if you need to. Always happy to convert in the notes underneath our video. But where is it safe for the parent to play around with natural holistic remedies? And
Yeah.
when do we get legitimately worried and need to do something?
Yep. So what I talk to parents and practitioners, all the time about is fever phobia, right? We
Yes,
all have fever phobia,
I totally agree.
yeah,
Yeah,
like, oh my gosh, my kid has a fever. Do I need to go to the emergency room,
yeah.
right? And when your kid has a fever and you do take them to urgent care or to the emergency room, the first thing the nurse is going to do is give your kid Tylenol.
Mm.
Without looking at the kid, right? Doesn't matter. Any number fever, right? And fever we consider over 100.3, which is 38.1 degrees Celsius,
Mm-hmm.
right? Um, so what I tell parents is, fever actually it's our body's natural way of fighting infections, right?
Yes.
It brings all those great white blood cells and those inflammatory chemicals to our body's defense, and the fever helps in a couple of different ways. It actually, all of those cytokines that are released help kill those germs that are invading. And the fever actually just like fever slows us down and makes our kid be a couch potato, it slows down, the germs, right, the microbes, so that we can fight more effectively.
Mm-hmm.
And fever actually will help reduce the duration of your illness, which is why when we reduce fevers artificially, the infection can last for longer periods.
Yeah.
So lots of benefits for fever. We don't want to be afraid of it. I tell parents there's no number that's too high, because that's another thing parents want to know. What's too high?
Mm.
Now, if you're getting over 40 degrees Celsius, which is 104 degrees Fahrenheit, I just want to check in and see, your child. But I have plenty of kids who, they're at 40 degrees Celsius and they are running around, talking to me. Maybe their cheeks might be bright red, but you would never know. And I take their temperature and I'm shocked,
Yeah.
right? Whereas you might have a child who's at maybe 38.5, 38.7, right? Which would be maybe 101 or so. Not very high, but they're laying on the couch and, moaning, and you'd think that, they had, the highest fever in the world. So, my take home message to parents is don't pay less attention to the number on the thermometer, pay more attention to your child. Because I don't care what number your child is at. If they're not making good eye contact with you, if they're not answering questions appropriately, if they're not aware of what's going on around them, then I'm worried about them and I want them to be seen, right?
Gotcha.
So, and also the duration of the fever. If they're viruses, you can have a fever for up to 4 or 5 days. But if you're going beyond those 5 days, I just want to know, because there could be some bacterial process going on.
Yeah.
Another tip off of a fever that I'd like to check out is if they have a fever and an illness and they're getting better, and then all of a sudden their fever spikes again, that's a sign that perhaps, a new bacteria has come and invaded and caused what we call a superinfection of their initial infection.
Okay.
So those are other signs. But again, I'm not so worried about, the fever itself. Fever is a good thing. And the reason I will treat a fever is if your kids don't want to drink, or if your kids are really miserable and can't sleep, as I mentioned before.
Yeah.
I don't want, when your child is sick, I don't want, when parents come in and say, well, they're not acting themselves. That's okay, right? Let your child be a couch potato. This is when I give children a free pass to watch TV all day long, right?
Yeah.
It's okay. We want them to slow down. So I don't want your child acting, quote, normal, right? Parents will say, well, when I give them the Tylenol or the Motrin, then they become themselves and they're running around. They can go on the trampoline and they play. Well, I don't want that, right? I don't want them to expend their energy being active and doing a ton of play. I want their energy to be reserved for their immune system to fight what's going on.
Yeah, it's so true, isn't it? Because that just breeds the adults that just take a whole bunch of pills and go to work anyway. And,
That's right.
every
That's right.
sign the body is giving us right then is to just slow down and rest. Yeah.
That's right. And we know as adults, when we do that, we might be able to work and kind of plow through, but then we are feeling miserable for 2 weeks, right? Whereas if we could just let our body rest and take time off from work and, sleep for 16 hours, then we would probably be better in a couple of days, right?
I remember from when my little guy was really small, I remember just intuitively not wanting to hit the Tylenol straight away. And I think I might have used it 5 times. He's 8 now. And I feel really comfortable with those times that I've used it, knowing that absolutely it was the right thing to do. And it was for sleep. It was just so he could actually get to sleep and get better. But I remember when he was so my protocol was always a little bit of lavender oil under the feet, about 500 milligrams of really nice pure acerola berry based vitamin C. And then this echinacea kind of mix that was in an appropriate dose for a little kid. And I would smush it into a spoon, and we called it the yucky one because echinacea is so bitter. And I would put maple syrup over it, and he'd swig it back and have a drink of water afterwards. And then so I did that a few times, and then he then knew when he was about 4.5, he's like, I just need the yucky one, some vitamin C, and a really big sleep, Mom.
That's right. That's right.
And it was just exactly what he needed, and it always has helped him. So that was our little protocol. Do you have any other little fever tips to support them while they're feverish?
Absolutely. Yep. So I mentioned the acupressure points, the essential oils. Elderberry syrup, right? You can easily make your own elderberry syrup if you're kind of a DIY kind of person. I'm not, so I buy my elderberry syrup.
I'm not a DIYer either. Yeah.
I would love to be. In theory I am, but
I spend too much time teaching everybody. I know, time to make the stuff.
It's true. So, but elderberry syrup, there's great research behind the efficacy of elderberry syrup in fighting viruses and reducing fevers. Awesome. Elderberry syrup actually has been found to be as effective, if not more effective, against H1N1 flu. Remember the whole H1N1 flu scare years ago? More effective than Tamiflu. And we could have another whole conversation about Tamiflu.
Yeah.
I mean, I could really go on about the flu treatments, right? Because
Yeah.
I mean, Australia was hit with a really bad flu season, right?
Yeah.
This year, we were hit with a really bad flu season this year, and now, as Australia heads into their flu season, we really want to make sure, that we know we're armed
Mm.
with tools so that even if we get the flu, we don't have to have flu phobia,
Mm.
right? That we know that there are things like oscillococcinum I mentioned, and elderberry syrup, and the echinacea, and high doses of vitamin C that can help us get over the flu so much more effectively and quickly.
Mm.
And the fact that Tamiflu really it doesn't work that well. The flu vaccine has not actually been shown to prevent complications of the flu, and is really, even in the years that they get the strains matched correctly to the flu vaccine, is not very effective in preventing the flu in the first place. So we need to, not be complacent and say, well, how can we support our bodies naturally to prevent the flu and then fight the flu,
Mm.
if we get it.
Yeah.
So yeah, so many things we can do. So
Mm.
elderberry syrup is one, in terms of flu prevention, right? Because of course we ideally would prevent illnesses if we could in the first place. Um, you know, uh, um, Making sure that your gut is healthy, right? There are certain strains of probiotics that have been shown to reduce the incidence of fevers and flus during the cold and winter months.
Mm-hmm.
There is one herbal formula, and it's been used in Europe, and so I'm not sure if you can get it in Australia, but it's called Immu Max,
Okay.
IMU, Immu Max, that also has been shown during those 12 weeks of winter, if you take it daily, to help prevent colds and flus and fevers and reduce the number of days missed from school for kids. I forgot to mention an African bush herb called Pelargonium pseudoides. So Pelargonium pseudoides is great, has been shown to, when you start initially at the onset of a cold or flu or fever, to reduce the duration of that upper respiratory illness. And that, I know you can easily find that in the States. It's called UMCA, UMCKA.
Mm-hmm.
Which is, I'm guessing, I mean, it shouldn't be too hard to find. I know you can
No.
find it over.
And I mean, we can so easily get things from iHerb if we need to.
That's
And
right.
yeah. Mm.
Yeah. So that's UMCA. So that's another great treatment,
Mm.
for colds and flus, right? So that has some good evidence behind it as well.
Fantastic. So much good stuff. And I'll ask you about one more, and I'm going to save a couple of these for the podcast because we're talking
Okay.
for the podcast as well. And then I can just direct everybody to have a listen to the show who wants to
Yeah.
hear more. But let's talk about the PPIs and what we can
Yeah.
do in these bubbers who are literally born needing reflux medication
I
within the
know.
first
I
month
know.
of life. I know I've had two nephews who've been in this situation. I would love to see, just in case I get any more nephews or nieces, what we can do
Yeah,
next
that's
time
right. That's
round
right.
to, fingers crossed, uh,
Yes.
to mitigate that and to reduce the need for pharmaceutical medication. What can we do to support their tummies and
Yeah.
bring them
Yep.
some comfort and start to build? Because you were saying before, right, that this actually then can set up a gut issue for the long
Mhm.
term. So we're wanting to build gut resilience, not break it
That's right.
down, even if
That's
for
right.
that short term benefit of a few months of a less colicky crying baby.
Mhm.
So what can we
I
do?
mean, yeah, there's a lot we can do, and I just, again, for everyone listening, I mean, just preserving our gut health is one of the best ways we can help our kids stay healthy and be
Mm,
healthy, no matter what's going on with them. So even if they do need antibiotics, right, we want to preserve their gut microbiome and their gut regulation with, you know, gut nurturing things like glutamine and bone broths, and getting in all those good probiotics again. But when you have a baby who has reflux, we know from right away that they have that gut dysregulation, from the beginning.
mm,
Oftentimes, it can stem from possibly from their mode of delivery. You know, we know that C-section babies are going to have more sort of abnormal gut bacteria than vaginally birthed babies. If babies are breastfed, they have more likelihood of having healthy gut flora. But, you know, and we also know that babies who have, you know, reflux and severe colicky symptoms, they have higher intestinal inflammatory markers, something called calprotectin in their stool than infants who don't have the gut distress. So there clearly is something going on, even for those babies who don't necessarily have reflux, but have colic, right?
Yeah.
So one of the things that we can do, and I went through this with my younger sister who has twin girls, and one of her baby girls was just, I mean, the fussiest baby you could ever see, and it was so obvious. I mean, from the time she was, you know, maybe a week or two of age, I mean, she would be screaming, belly just distended and really hard, and, you know, screaming all night, you know, crunching her legs, and, you know, having such a hard time pooping, and spitting up some, but you could tell there was a lot of silent reflux too, right? Where she'd be arching her back, and it wasn't necessarily coming out. So, and she was breastfeeding. So when I think about that, you know, we always think, okay, what are some of the major food culprits, you know, for a child? The biggest one is dairy. It's cow's,
Yeah.
right? And so if you have a baby with reflux, or an older child with reflux, because toddlers and older kids are being diagnosed with reflux as well, you know, the first thing, just take out all the dairy. If you're nursing, take out all the dairy from your diet. Even a trace, I've had some moms where even just that little splash of creamer in their coffee is making a difference. So everything, you know, cut out the dairy. There can also be other foods that are triggers, because we know babies, you know, many of your listeners have heard of leaky gut. Babies are born with a leaky gut, right? That's just their intestinal lining is not as mature. So they, by virtue of just being infants, have leaky guts that then mature. And usually the leakiness is more or less healed by around 6 months of age, which is why the recommendation has been, you know, just breast milk or formula, you know, until babies are about 6 months of age, and then start introducing solids.
Yeah.
Right. Now, breast milk, even if you can have a little bit, is going to go a long way in healing the gut lining, right? There's so many other factors, like these things called human milk oligosaccharides, that help support the gut lining. But, you know, cut out the dairy for, so that means, you know, going on for, if your baby is being formula fed, going on a hypoallergenic formula, because I don't want your baby having a ton of soy formula either, right?
Absolutely.
So you're going to be, you know, temporarily trying one of these broken down, what we call hydrolyzed, or these kind of pre-digested formulas, which unfortunately don't taste very good, but we're going to clear out food sensitivities and allergies as a factor.
Yeah.
If you're breastfeeding, you want mamas to take out, and this is where mamas go on an elimination diet, taking out dairy, gluten, soy, eggs, and nuts and seeds. Maybe corn if they're having a lot of corn. So I told my sister this, and she's thinking, oh my gosh, okay, what? Like,
a whole bunch of people just went, you've got to be kidding me. Yeah.
And they're saying, I'm nursing, I'm starving, right? Like, what can I eat, right? So we want to shift that mind frame, shift that mindset, and really think about what you can eat, right? Because you can have any, you know, wild, lean protein, right? You know, healthy fish, you know, grass-fed beef, you know, organic chicken, right? You focus on all the meats you can have, and every single fruit and vegetable, right? Load up on the produce, and the healthy meats and healthy fats.
I
Right?
think smoothies for this particular time, it can be really handy as well, because you can just whip it all up in a blender and get some good avocado in there, some hemp seed oil, and things like that. And because, I remember that time, and I remember thinking that I just need to get it in.
So, and you know, if foods are a culprit, right, your babies are going to respond. Oftentimes within 2 or 3 days of the elimination, you're going to have a happier, calmer, healthier baby, right? And then I recommend continuing that elimination for at least 2 weeks, right? And then one by one, you could try those foods back. One by one, meaning, you know, one every 4 or 5 days, right? To see, if you go back on, soy and your baby is fine, then okay, soy wasn't one of the culprits. The reason why I have mamas really try to eliminate all of those foods at one time is because, by the time you take away one and then try it and it's not making a difference, and you take away the other, then you might be looking at 2 or 3 months of this trial and error.
Yeah.
So we just want to get all the factors out that we possibly can because then it can be more than one food, right?
Yeah.
So then we introduce one food back at a time until we get to the point where we know, okay, what is it, right? For my sister, it was cow's milk, and it was soy, right? And so those, no more tofu, no more edamame. She just took those out, no more cow's milk, but she was able to introduce back again nuts and seeds. And I recommend most mamas anyway to be very light on the gluten if they're having gluten. So and she already was, not having much gluten. She actually knew she was better off of gluten, but while she was pregnant, let it slip back in, and while she was nursing, let it slip back in. So she just went back to gluten-free because that was just healthier for her. So that's one thing, seeing if there are food triggers. Another thing, probiotics are a must. We know that there's some probiotics. There's one particular species called Lactobacillus reuteri that's been found to be very helpful for infant, gastric distress, colic, reflux symptoms. So absolutely we want a probiotic that has that strain in it. But I don't recommend just one strain because we have trillions and trillions of gut bacteria with so many different strains. So having an infant-specific probiotic, because babies under 2, their gut flora looks different than when you're over about 2 or 3. So an infant probiotic that has the Lactobacillus reuteri in it is really key. This is where I actually do use essential oils in these little babies. So chamomile, right? Chamomile is so great for digestion and spasm, right? Chamomile is an antispasmodic. So when your babies are curled over and they're cramping up, or they're arching their backs and really uncomfortable, chamomile can be really, really helpful. And I do use acupressure points too. Now I went over to see I flew to my sister in Colorado, and I brought my acupuncture needles and I did acupuncture for my niece. But not everyone has a kind of a built-in acupuncture.
Here's some I prepared earlier. Yeah.
So the acupressure points. So
cool.
Acupressure points, what I use, there's one point called CV12, and this is where you can Google CV12, C as in Charlie, V as in Victor, 12 acupressure point, and that point is if you you can't see me, but if you go to the middle of your rib cage, right, in the middle of your sternum, and maybe I'll stand up and show you, right, the middle of your rib cage, kind of right here, right, where your rib cage meets, and then find your belly button, right, your baby's belly button, and the point halfway in between.
Oh, okay.
Okay, that's CV12, right? You can massage that, and I rub some chamomile essential oil right into that point, okay? I did acupuncture there, and then I rubbed essential oils, right? But otherwise, you can just use the acupressure point there. So that's one really great digestive point.
Well, that's the start of peristalsis, that point, isn't it? Kind of like just helps things to be going down instead of up. Yeah.
That's right. That's absolutely what it does, right? It helps the chi from our food, right? This vital energy from our food move down and become a nourishment and energy instead of coming back up, right? So that's probably the main essential, the acupressure point. And there are a couple of other points that I use as well. But if your baby has reflux, try that one first, right? With essential oil. And homeopathic medicines. Remember I mentioned homeopathic medicines are ultra diluted, and again, you want to use a reputable manufacturer, and the manufacturer I use is Boiron, which is a French homeopathic manufacturer, and they're here in the States, but they have a long history of safety, really, really high.
Very good company. As a half Frenchie, I can attest to it.
That's right.
Absolutely.
And great quality assurance practices, right? And so I use there are. Homeopathy works best if it's really individualized to how your child is experiencing their illness and their symptoms, but Boiron has a homeopathic kind of reflux colic remedy, a combination called Cosintol that can work great. And because they're so ultra diluted, I do use homeopathy as my first go-tos for infants and for nursing women, because I don't have concerns about toxicity or possible side effects or possible medication interactions like you would with herbal medicines, because herbal medicines are basically natural drugs.
Yeah, so true. Look, we could talk about all of this for hours, but I'm going to ask you, I'm going to ask you one more question. The cuts and scrapes.
Yeah,
Traditionally we've used, stuff that is full of nasties, all sorts of crazy
yeah,
stuff, petroleum
yeah,
derived chemicals and things like
yeah.
that in there. What's your go-to for cuts and scrapes?
Well, I have my go-to is calendula,
Okay.
right? Calendula is marigolds, right?
Mm,
The why calendula? Because calendula will help, if you have an open cut on your skin, it's going to help what's called granulation tissue. That's
okay.
the new tissue. It's going to help promote granulation tissue from forming and healing and joining the two, kind of split ends, right, of your
Mm,
skin. Calendula also is a great antimicrobial, so it's going to kill any bacteria or any germs that are starting to grow so you don't get problems with skin infections.
yeah.
It helps prevent scarring too, so it has a lot of different effects there. My next favorite one is actually Manuka honey, right?
Oh,
Manuka
yes. Yeah.
has great it helps prevent staph infections. And a lot of kids, when they get cuts or if they have eczema, they tend to get impetigo, which is
Uh-huh.
highly contagious, right? That's a strep or staph infection of the skin. And so Manuka honey actually kills staph, even the scary MRSA, right? That scary methicillin resistant Staph aureus that everyone's really worried about getting.
Mm.
So these would be my two go-tos. And then, for if we're talking about first aid, kind of bonks and bumps and bruises and sprains,
Mm.
homeopathic arnica.
Oh,
Arnica has
I'm so
shown,
glad you said that. I
right?
love the stuff.
Yep,
Mm.
arnica you can use topically, right? There's arnica cream or gel, right? If your child, runs into a wall and has a goose egg on their head, you can put arnica topically, on the skin to help reabsorb that bruise faster. You don't want to use arnica on open skin because arnica can irritate, the open skin. That's where calendula you would use if you have open
Hmm.
skin. But arnica pellets, homeopathic pellets, promotes wound healing, reabsorption of the blood. It helps prevent bleeding too. In fact, plastic surgeons, I mean, there's some good plastic surgery studies showing promoting wound healing after surgery, right? And
Yeah.
so arnica, anytime you have a bump or a sprain or a bruise, you want to have arnica. I mean, I recommend that all parents, grandparents, nannies, babysitters, when you go to the park, you need to have arnica
It's
in
in
your
the
diaper bag,
handbag. Yeah,
right? Gotta
absolutely.
be right there,
Mm.
right? For your toddlers and for your older kids, right? They fall off the monkey bars and bang their elbow. You put arnica on right away. Give them the arnica pellets.
Yeah, music to my ears.
Yeah.
I don't know what the stereotypical thing that every American family has, but in France, every French family has arnica. We've all got it. It's in
Yeah.
your handbag
Yeah.
if you've got little kids. It's in your medicine cupboard. You've got the cream. You've got the pellets. We got the
Yeah.
sprays. All the whole shebang. So it's so funny that you should
Arnica is
say.
great.
Yeah, it's great stuff. Look, thank you so much for your generosity, Elisa. I mean, we covered so much wonderful stuff there, and I think just starting to have the confidence with knowing when it's okay for us to take over and use these beautiful holistic
Yeah.
therapies
Yeah.
is just so important because we're using way too many drugs on our kids. It's not necessary so many
Yeah.
times, and I think after hearing this chat, then hopefully that means people have more of the confidence
That's
to
right.
step ahead. Yeah. So thank you so, so much.
Oh yeah, you're welcome. My pleasure. I'm really, that's my mission, right? It's to help parents feel comfortable, really incorporating and integrating more holistic um, methodologies into their family's sort of healthcare toolkit, right? I mean, that's
Yeah.
and the thing with natural remedies is as you use them, they actually not only help with the acute illness, they help strengthen your child's immune system so they'll, get stronger and healthier and prevent illness in the long run too.
I hope you loved today's show as much as I loved bringing it to you. I want to remind you that if you are someone who craves a low tox community that is judgment free, full of empowerment, has health professionals and building health professionals that can support you, as well as me in there answering questions multiple times a week, I want to invite you to join the Low Tox Club. For the price of less than a cup of coffee a month, you have an annual membership for $49 Australian, so it's about $30 US or euro, that allows you to have a member masterclass every single month with a health professional or global expert from the podcast, where we have them to ourselves for an hour to ask questions and deep dive further. You have the beautiful supportive chat group. You have Q&As with me answering questions. We read books and talk about them, and a whole bunch more. You can head to lowtoxlife.com, hit the explore tab, and join the club is the very first option on that list. Of course, we have over 10 evergreen courses that you can jump into anytime, whether it's navigating everyday low tox swaps with our Go Low Tox signature course, whether you have kids and you're wanting to know how to best support them with our Low Tox Kids course, whether you're planning a family and looking at a healthy low tox preconception journey, reducing inflammation, especially the chronic kind, with our Inflammation Ninja course, many other courses. You can again head to lowtoxlife.com, hit the courses tab, and you'll see all of the options, which includes a business course, my Low Tox Method program. A lot of people don't know, but I was doing a lot before starting Low Tox Life in 2009, and I was a business consultant across hospitality, health, retail, and cosmetics. I have been in business consulting for a very long time, so I absolutely adore helping people move into the low tox space or develop their low tox businesses. So that's a way I can support you. And then, of course, there's our wonderful social media communities at Low Tox Life on Instagram, and of course, the website with over 250 gluten-free recipes, blogs, downloadable PDFs to help you navigate wanting to get rid of synthetic fragrances in your school or office. I could go on. So head to lowtoxlife.com, see what takes your interest or fancy, and thank you so much for being a part of our podcast community. I love reading your reviews. I appreciate every follow and subscribe, and I want to just remind you to finish off that if there's anything you heard that you found interesting from a medical or scientific perspective, it is intended as education only. Please always chat to a health professional who knows you and your situation best. I'll see you next week. Bye.